my co-author, Kevin McMahon, and I were working together for over a decade. We ultimately published a paper in 2012 using a technology that Kevin had helped develop, which would quickly disseminate blood glucose information to different points very quickly. Back in the era before anyone knew what the cloud was, we were using the cloud, okay? Well, that evolved into a paper that was that characterized the concept of frequent pattern management, basically looking at one's blood sugars on a very regular basis and making more frequent adjustments. Our research studies showed that if parents were given this information daily, every evening at 7 o'clock, that they would tend to make more adjustments and changes on their own independently. Assuming they were all trained in the same fashion, these people gravitated to more frequent changes than those that were getting conventional therapy. And by conventional, I mean bring your blood sugars in quarterly, let's look at them, we'll make some adjustments to your care plan. And so we found that frequent pattern management did make a difference. Well, as the era of continuous glucose monitoring started to blossom over the next few years, we took that same concept and applied it to that technology. Although it does not require a CGM to do this, you could also perform sugar surfing with frequent blood sugar checks as well. A CGM just makes it a little bit easier to do. But the concept behind sugar surfing was what I call dynamic diabetes management. What we've been teaching and what I teach people, just because of the nature of my job, is called static diabetes care. In other words, you bring your data to me, we look at it, we arrive at a joint decision together about what the script is going to be, so to speak, for what you're going to do, how much you're going to eat, how much insulin you're going to take for these situations, and then you follow the script. That's what I call static care. And then every few months when we review the data, we'll retrospectively review that data and make a new script. And that gets the world moving forward for the most part. But now that we have the ability to see these data in real time or near real time, then that changes the whole perspective. And so that's how sugar surfing came about. It's what I call dynamic diabetes management. It's both proactive, which is planning an action and then executing it. It's also reacting, which is dealing with the unexpected, the things that just happen to you that you can't expect. And in reality, we're always doing that. This just shines a light on that. And in a perfect world, half of your care is what you plan, the other half is what happens to you. If everything were totally predictable, that would be a very boring world to live in to begin with. But you have to embrace the unexpected. And sugar surfing does that. I'll give you a metaphor for this in the sense that if you checked your blood sugar every minute from one day, you'd have roughly 1,440 blood sugars. What are the statistical odds of one day and the next day being exactly the same? Well, infinity, never, right? And so you have to embrace the idea that blood sugars are always on the move. They're always going up and down. The only person with a straight line blood sugar is a dead person, as I say. And blood sugars, even in non-diabetic individuals, are always are fluxing. In other words, big shifts, or drifting, slowly moving. And sugar surfing just takes that into account and embraces it and develops methodologies to attack that problem as it's happening. In other words, as your blood sugar is drifting up, take an action to make it push it back down. If it's going down, take an action to pull it back up. And the book goes into an explanation as to how to do it. There are no formulas in the book. It's not a mathematical algorithm of any sort. It's basically teaching people how to train themselves to use their own skills, their own observations, whether they're collecting lots of blood sugars with a meter or whether they're collecting it with a CGM device, and then using those data to make the best possible self-care decisions. That's what sugar surfing in a nutshell is all about, dynamic diabetes management. I think that just as sugar surfing is an individual art, if you will, the benefits of it can be drawn in from all of those things you mentioned. It could be drawn in from the attitude of a lower A1C. It could be drawn in from having fewer severe hypoglycemic events. For me personally, the A1C was not my focus. I already had what I felt was a reasonable A1C. For me, it was the severe lows. I was more prone to have low blood sugar events that would be debilitating to me. My wife would have to rescue me and give me something orally to get me out of a low blood sugar. So I was freed from that with this approach. I was more in touch with where my blood sugars were going, what forces move them, what situations move them, and I became a student in my own body, if you will. So this is the most individualized form of diabetes self-care there is. Like I said, there is no formulas at all in this book. If anything, I spend one full chapter dispelling most of the things we hold sacred in diabetes. I published that online. That was the false idols chapter. Everything we deal with in diabetes has some degree of variability in it. Our meters are not precise. Our A1Cs could be off by a slight amount. Our foods are digested at different rates. Even the same foods would be digested differently from one day to the next. And those are just a few of those examples. Our ability to count carbohydrates, as Ted was asking me, that sometimes don't get taught early enough. Even if you do teach people this, a paper that was published a few years ago at the Barbara Davis Center pointed it out, that even well-controlled adolescents that can carb count very, very effectively within 1 month of their initial training. Only 23% of them can be accurate within 10 grams of the same foods that they were taught on earlier that were their favorite foods they like to eat. So there's variance built into that as well. So there's variance on top of variance on top of variance in diabetes. So I don't focus on that so much as in sugar surfing, except to say that you have to embrace that. You have to expect variability and then learn how to react to it. I have an image in the book I took at a surfing competition in Florida last year, which basically says that you cannot control the waves, but you can learn how to surf. And I think that really sums up sugar surfing in many ways, metaphorically, is you can control the waves of sugar that flow through your body, either from stress, illness, a forgotten insulin dose, or so on, but you can learn to manage them in the moment. And it is management in the moment. And now that we have more frequent checking opportunities, whether it's with a CGM or just checking lots of blood sugars, now we have the opportunity to capitalize on those data to make better self-care decisions, and in turn either lower an A1C, avoid severe low blood sugars, or just feel more in control of diabetes. If you want my honest opinion about the reward, it's that I feel like I'm in control of my diabetes. I mentioned earlier a metaphor I used about whether I drove an automatic transmission or a stick shift. I like stick shift because I feel like I have more control over my vehicle. I like sugar surfing because I feel I have more control over my diabetes. I don't even need an insulin pump to do it. In fact, when I developed sugar surfing, it was on injections. And people would come up to me and said, well, you have to be on an insulin pump to do this. I said, well, no, sir or ma'am. I developed the whole idea of sugar surfing while I was doing injections, and I had to go back on a pump to prove that it would work with a pump. Yes, there are certain advantages a pump may provide for somebody who wants to sugar surf, but it doesn't matter what form of insulin delivery you use. It doesn't matter what type of blood glucose meter you use. It doesn't matter, quite honestly, what kind of meal plan you use either. It does matter on the decisions you make, and that's what the book focuses on, is how to teach yourself to make the best decisions based on your own personal observations and not rely on an external force to tell you what to do. In terms of personal qualities or attributes that would best lend themselves to a sugar surfing attitude are the things that I alluded to earlier at the beginning. When I first encounter a new patient, I try to divest them of any guilt, shame, fear. Those are the things that drive us. If we don't understand something, first of all, we tend to be fearful of it, and then we tend to ignore it, okay? Maybe in that order. And so shining a light on really what diabetes is and isn't is one of the first things I try to do as a diabetes educator. And I've been a certified diabetes educator in the United States for 25 years. I'm, I think, one of the longest serving physicians at the CDE. And that's my focus, is to teach people more about this. So if I shine the light on this, it's less scary, if you will. There's a phrase in the talk from an old playwright which basically says there's nothing in the room when it's dark that isn't there when the lights are on. And that's a very true statement. And if you can shine a light of information and knowledge on diabetes, it becomes less scary. And a lot of my posts were related to that, which ultimately culminated in the book, which were, please put this together in one place so we can all look at it. But most of everything that's in sugar surfing are things I've already put out before. They're on the internet. They're just in the ether out there somewhere. And these are all now collated with some additionally new material. But the point is that there's a lot of education we don't get, whether it's in the United States or the UK or anywhere in the world. Education is our greatest deficit. There's plenty of machinery, there's plenty of technology out there, but we still have diabetes, and we still have people that are struggling with their control. The conception about who benefits best from sugar surfing in regards to age is much like what I heard back in the early days about insulin pumps. People used to think we couldn't give children insulin pumps, yet we've learned that those are the people that sometimes benefit more than anyone else, are children with insulin pumps. So no, I have parents of toddlers, newly diagnosed, who are using these basic principles. It's not using all or none, it's using some that best fit into what you want to do. Through the workshops, I've reached, I think now, thousands of people. Some of the successes that I've heard reported from the workshops have been a greater sense of satisfaction in their own personal level of control, or that of their sons or daughters or their family members that have type 1 diabetes. And that's really the take-home message from sugar surfing, is finding your own set of rewards from doing it, whether it is from having whether it is embodied by a lower A1C, reducing the frequency of severe low blood sugars, reducing the incidence of extremely high blood sugars as well. So I think everybody takes their own personal rewards, and that's what it's meant to be. It's not a guarantee of anything, and I think that's what empowerment's all about, is once you're empowered, you find your own rewards. You're driven by your own rewards, and people ask me sometimes, why do I do this? I like to wake up and feel like that the diabetes works for me. And for many, many, many years, I felt like I worked for the diabetes. And this is a subtle but powerful point to make. And that is, now I feel the diabetes works for me. And I sometimes use the metaphor of a boot kicking it in the tail. My son drew all that for me. But that's exactly, it kicks the rear end of the diabetes. And I like to point that out, and that is the most empowering part of that to me. The A1C is secondary, in my opinion. At one point, I thought it was the primary thing. Once you get to this point in your thinking about sugar surfing, no, A1C is not. It's nice, it's in range. It's in the non-diabetic range actually, but I have a sense of control, of authority over something that for decades held authority over me. And I think that, to me, is the most empowering point of this, whether I'm talking to a parent of a child with diabetes or an adult with type 1 diabetes. And I think that's the universal appeal of what you would call sugar surfing. I think another advantage of having had this condition for some period of time now is being able to, and I'm very open with my own, challenges. I had problems with severe low blood sugar, middle of the night hypoglycemic events, which were debilitating. That was very disheartening as a person that has this. So I can certainly speak to the point of feeling that, gosh, I'm going to be facing the rest of my life having to deal with this, and one of these days it may be the end. And I harbored those fears like I see a lot of people do now, but this freed me of those fears. It gave me a better understanding of my own diabetes that transcended my own medical knowledge of it and personal experience. It was the ability to see it in real time through frequent checking that allowed me to then learn its weaknesses, to learn how to prevent things. And that is the most empowering part, the most empowering message of sugar surfing. And does it take time to do it? Yeah. Does it take commitment to do it? Yeah. It takes all of those things. Are some people more ready and prepared to do it than others? Yes. What are the key elements that make it work? Supportive family and having an attitude of empowerment that you can cultivate in your own life. Try to see the upside of things if you can, which is sometimes, I know, challenging to do when it seems that life is coming down hard on you. But as a person that's had it for 50 years, I can speak that, yes, I've had my ups and downs like everybody else, but this has kept me more positive in my diabetes than I ever thought possible. At one point, I thought I'd never make it to the year 2000, when I was younger, because of all the things I'd heard as a child about longevity. Now we're learning that people with type 1 diabetes may live as long, if not longer, than people without diabetes, because they take more time and attention to their own health that the non-diabetic population doesn't always take advantage of.
Definitely the case.
And so I think sugar surfing takes that one more level.